People pretty commonly know about and understand the concept of public defenders, how people who can't afford an attorney have one appointed for them in criminal proceedings. There's no comparable entitlement in civil need. Instead, we have nonprofits that are funded by different grants and donors to try to help people have equal access to justice in non-criminal matters. The Medical Legal Partnership is providing legal aid services as a health care. It started actually by a pediatrician up in Boston who was getting frustrated when his pediatric patients with asthma kept having exacerbations, even though the parents were doing everything right. But the doctor learned that they were living in substandard housing, there were roaches, there was mold, and the landlords weren't fixing the problem. So he hired a lawyer for them who could come in and sue the landlords and make them fix the problem so that his patient could be healthy. So that's the basic idea, is coming together, these two very different disciplines coming together and collaborating to improve health.
I don't think people realize how much health is affected by legal issues. For example, if you don't have a safe home, if you were terminated from Medicaid, you might not realize that legally, your landlord has to follow certain rules. So the partnership that we've had has been really successful in targeting those type of issues for our patients.
The less stress that the patient is under on the outside world, the more healthier they are. And believe it or not, the stress it does deal with their health. We've seen several happy endings, and that's what makes it all worthwhile. Once you see that the patient is being taken care of on the outside, then we can deal with the health issues on a long-term basis.
We're getting to a point where we're getting as much as we could from medical interventions. And we knew that we needed to begin to address the social context issues, the social determinants of health. And in that, Classy has been an excellent partner. The programs and policies we have in place are designed to address the health challenges of all Delawareans, but especially the vulnerable among us. These are people who, in different circumstances, may not be able to reach out for the tools that can help them out of their particular predicament. And so our interventions really don't make much of a difference for them until this switch is thrown. Then all of a sudden, all the other things that we've tried to do to address their challenges suddenly become effective.
We serve Delawareans throughout the state. We have an office in each county. We have 3 different medical legal partnerships. One is with the Delaware Division of Public Health, and it's a maternal medical legal partnership. They have asked us to help represent pregnant and postpartum mothers, working with what's called the Healthy Women, Healthy Babies program at clinics across the state, and also a nurse-family partnership program where public health nurses go into clients' homes for the pregnancy and 2 years postpartum to help them navigate all of the different issues that come up. The second is with the Christiana Care Health System, which is a large hospital and health system here in Delaware. And that is to serve their primary care patients who are at or below 200% of the federal poverty level. And then our last medical legal partnership is called the Delaware Homeless Veterans Medical Legal Partnership. And it's working with Connections, a local mental health and substance abuse service provider, but they also have supported services for veterans and their families program. Veterans that they're working with who are either homeless or at risk of homelessness. So it was a pretty natural collaboration.
Legal services to our veterans used to be something that wasn't attainable. And now that we've been able to provide legal services with our partnership, it's definitely helped out our veterans that are in need. The impact has been really substantial for the veterans that we serve. They're able to reduce the stress, not have to worry about, where they're going to sleep tomorrow night. They're looking at their 30-day evictions and knowing that somebody's going to be able to help them out with that, to give them maybe a little longer to plan. Nobody ever really plans to become homeless.
I think the Medical Legal Partnership has just added a tool to our toolbox. Mm-hmm. We never like to see patients or community members come in and us not have help for them. So this has just added something else that we can provide.
They usually refer because they've been working with a patient for a while and they've hit a point where they don't know what else to do. Sometimes we hit a point where something's kind of beyond the scope of what our office handles or can handle. So to have two groups of people working on it from different angles, I think it's a lot more productive.
I got hit by 2 cars at the same time. Somebody told me it was a station wagon or old Mustang, and they said my brain was on the ground. They said they picked me up and put half of my head in a plastic bag and put me on that, and then I was in a coma for a while. They said my mother came to the hospital because they was going to cut the machine off and all that stuff. And I woke up. I stayed on the streets for like 15 years, physically on the streets, winter, summer, for 15 years. I'm talking about cold, I was on the streets.
When Mr. Glover was referred to us, they had requested a administrative hearing in front of an administrative law judge. Right now, the average time when you put in your request to when you get a hearing is 19 months. So what we did is when Mr. Glover was referred to us, we worked with the social workers who referred him, and we got a letter, saying that he was homeless, and we did an expedited hearing request. In a month after I submitted the expedited hearing request, he was just approved because his file got on an administrative law judge's desk, and they saw, that he was clearly eligible, and there was not even a need to go to a hearing. Mr. Glover had applied several times in the past and been rejected. For this particular application, he applied and then was rejected. He requested reconsideration, which is when the application goes in front of a different reviewer, and they also rejected him. And then he asked for the hearing.
I just like to just wake up knowing I got that coming every month, that I can get my medicine all the time, stable housing. Everybody come up to me, Chris, how did you get yours so fast? I said, you got to have a lawyer. You got to keep up with them. See, you get most people, after they get their stuff, they're like, forget this, forget that, forget that. I always call my lawyer, always, all the time. Oh, everything's all right, everything's all right. That's what I like hearing, Social Security's cool. Don't worry about it. When she told me, the judge said everything's cool, don't worry about it. And then when me and my other counsel went to Social Security, and the lady shook my hand and said, Mr. Glover, don't worry about nothing. We got you. See, I had all my doctors. All my doctors was right there for me. Every last one of them. Every last doctor I had said, Chris, we got you. My doctors was right there.
We've had clients that are referred on one very small, discrete issue, but as we build a relationship and kind of peel back the layers of their lives, we discover there may be 3 or 4 other unmet legal needs that we're also able to help them with.
Every 3 months, the Medical Legal Partnership staff identifies certain topics that might have come up a lot more, and they provide our staff with specified training. So it's been extremely helpful and beneficial for our staff to just know a little more. So when they are in the patient rooms, if they hear certain keywords, they know, oh, maybe this patient would qualify for the program.
The training that Classy has brought to my folks has been so tremendous. To be able to understand the landlord-tenant code, to be able to have that higher level conversation, to bring that real support, because we can talk about domestic violence issues, we can talk about supports, landlord-tenant code. We have that base knowledge to immediately be able to look at a situation and say, no, that's not right. I'm connecting you to legal services immediately.
For each of our medical legal partnerships, we are working with public health evaluators to analyze the impact that we have on health so that it's not just our belief that it's working. We provide a survey before and after, and the evaluator compares their stress and mental well-being before and after. And we have had statistically significant positive impacts on health in that program.
At the very minimum, you would have helped somebody out of a difficult situation. But I guarantee you that you will see the impact in people's health as well.